There is no quick solutions i- unless you really understand the problem, and then you have to prioritize what you're going to do. There's endless things that we can invest in and do, but we really went about this very seriously.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest today from one of my favorite institutions, Houston Methodist, Dr. Schaal, who's just an incredible physician leader with so many years of really interesting experience trying to push healthcare forwards. Dr. Schaal, please introduce yourself.
Hello, my name is Shlomit Schaal. I'm a clinician scientist. I've been in academic medicine my entire career. I'm a retina surgeon by training. Before I joined Houston Methodist, I was the chair of the Department of Ophthalmology and Visual Sciences at the University of Massachusetts. Then I became the president of the medical group at UMass Memorial Health. And in the past 2 years, I'm here at Houston Methodist as the chief physician executive and as the CEO of the Houston Methodist Physician Organization.
It's so impressive to have you on, Dr. Schaal. You have kind of continued educationally to advance your career. You have your MD, PhD in biochemistry. You also not too long ago got your master's in healthcare management from the Chan School of Public Health at Harvard. And so you've advanced your career in education. You've also continued to kind of level up in your impact as time goes on to where you are at Houston Methodist. I have to ask one of the first questions. What made you land at Houston Methodist? With all your accomplishments, you probably could have gone anywhere in the country. What brought you to Houston?
Yes, so I didn't know much about Houston Methodist, and you and I kind of discussed before the show that not everybody has been to Texas, and it's certainly if you're on the East Coast or the West Coast of the United States, the state of Texas is very far away from you. However, I really learned about the leadership of Dr. Mark Boom during the pandemic, and during the COVID pandemic. If you remember, Houston Methodist was one of the leaders in healthcare during that very difficult time for healthcare and for our country. And so I became intrigued. When I interviewed for my next opportunity, I already admired Dr. Boom for his leadership style and for his courage. And as I went through the interview process here at Houston Methodist, I discovered that this is a wonderful organization, one of the leading organizations in terms of employee engagement. People love to work here. We are really, our motto here is leading medicine, as you can see behind me, leading medicine. And it is really, we are really leading medicine in so many different fronts. And so I'm just delighted to be part of this organization. You said that I am, I have invested a lot in my education. I still feel I'm learning here so much from so many leaders in this organization, not only Dr. Boom, but his entire executive team. Really incredible people that I look up to and learn from every day. So I'm delighted to be part of this organization.
And one of the reasons, as you said, most people haven't, or a lot of people have not been to Texas or have not thought of it as this medical hub. But as I have, I met Henry Burns, who was one of the fellows there. I met Ariane Dowdle, who's doing chief culture work now. I've met a lot of other staff members along the way. And even though I've never been to Houston, I can tell the excellence, the commitment. I've also read a lot of your data. I've read the tax returns. I've read employee engagement reports, and you all really are doing incredible things at Houston Methodist. The data reveals that. One of the things, though, that I really wanted to talk about was this important initiative that you're all working on. And this is that Joy in Medicine initiative. And this is so important because as we're talking to our audience, we're hearing, of course, that physicians are burnt out. But even more concerning from the administration end is that administrators don't know how to help. They're kind of stuck spinning their wheels, trying to assist their physicians, trying to reduce the burnout. And they're becoming burnt out themselves, trying to help the physicians in fighting their burnout. And so when I heard that you were working on this incredible initiative that had been really successful, Joy in Medicine, I really knew I wanted to talk to you about it. Can you share a little bit about what this initiative is and how it came about?
Yes. So first, a little bit about us, because you kind of touched about Houston and where we are. People are thinking, Houston Methodist. Are you only in Houston?
Mm,
And so I would like to give a little bit of perspective to people. What does it mean to be in Houston? And I have a little bit of a diagram here that I love. But what it says, you're in Philadelphia, right?
yes.
So you can put the entire city of Philadelphia next to Baltimore and Chicago and Detroit, one next to another like a puzzle, and that whole entire area would be smaller than the area of Houston. So Houston is a giant city. So if you think about it, it's actually bigger than many states. It's almost at the size of the state of Massachusetts. We wanted to give that perspective to really say we are dealing with many people. We have about 33,000 employees at Houston Methodist right now, and we employ almost 2,000 providers, physicians, and APPs. But in our hospitals, there are also physicians who are not employed, or providers that are not employed but work in our different hospitals, almost 9 hospitals. I think in like a week or two, it's going to be 9 hospitals throughout our system in Houston. So really, when I joined, I told you that I knew that this is a great organization, and I was basing it on our Press Ganey data. And I also have this in front of me. Our employee engagement scores here at Houston Methodist in 2023, when I joined the organization, was 4.46 out of 5, which is, just to translate it, it's the 96th percentile ranked in the country. So in terms of employee engagement, we are really doing something really well here at Houston Methodist. And not only that, if we compare it year out after year, we keep improving. Our employee experience is going up. If we have to compare it to our physician experience, the physician experience in that year, 2023, was 4.18 out of 5, which still is above average score. It's a good score. It's not a terrible score, but it actually aligns with the 66 percentile. So nowhere at the top percentile that we want to be.
There's
And
a
we
gap
always
there.
say, yes, there is a gap, and we call it the physician-employee gap. Why is there a gap? If we are employing, and I'm talking about employed physicians right now, and employees who are not physicians. So if we're employing everybody, how come the experience for our physicians, our healthcare providers, is so different than our employees? And, I'm a physician scientist. I'm always curious. I don't come with an answer. I always come with a question. So the question was why? And how can we discover the reasons for it? And not only that, what can we do about it? So when I joined, I didn't know a lot about wellness or professional fulfillment or anything, and I had to really learn. So one thing that we did here at Houston Methodist, we joined PWAC, which is an academic consortium for wellness for physicians. So Physician Wellness Academic Consortium, PWAC. It's led by Stanford, but there are many of very prominent healthcare systems all over the country that were already part of PWAC. We joined in 2023, and we learned about their framework for wellness. So they develop a framework that I think that makes a lot of sense, and it has really 3 parts. One part of the framework was really the culture of wellness. Culture of wellness means, does your organization, does your healthcare system really care about wellness? And, how is it manifested in your everyday life, in the way that the leaders talk, in the way that the priorities are set? So this is one part of the 3 parts of the frame. The second part is really the efficiency of practice. how efficient is your everyday life? You come to clinic or you come to surgery, you need to take care of your patients. How easy or how difficult it is for you to do so. So this is the second part. And then the third part is really personal resilience. We heard a lot about personal resilience during the pandemic as well. We heard it, from our parallel industry, which is the tech industry, everything that, Google and Amazon is doing for wellness for their own employees. And how might you develop personal resilience in employees and specifically in physicians? So we completely adopted that framework, and we went on something that we called our Jimmy tour. Jimmy, it's a Texan name. It stands for the Joy in Medicine Initiative, Jimmy. And that tour, we went and met our primary care physicians where they are. We had to start somewhere, so we started in primary care. And you know that primary care physicians, if you do, wellness and professional fulfillment surveys, you know that usually primary care physicians score at the bottom of the pack. So we wanted to start with them and see what can we do, what can we learn about their experience, taking this frame way into our mindset. And we asked 3 questions. We went to the physicians where they are. So I told you how big and how large Houston is. So sometimes it took us 2 hours to drive to where our physicians are. And sometimes, it took us less. But when I say we, it's not only me, it's myself, but my entire executive team. And we have also a professional fulfillment and experience team. We went to meet the physicians where they are, and we asked 3 questions. The first question is, who are you? We introduced ourselves as the executive team in person, and we asked them to introduce themselves so we can know them on a personal basis. So this is the first question. Who are you? The second question is, what's good here at Houston Methodist? What do you like? Why do you work here? And the third question is, what can we do better? What are the things, we call them pebbles in your shoes? What are things that are causing, point of friction that really kind of ruin your day? And what can we do to make them better? So that was going on in the entire year 2023. And that's how, in a very meticulous, disciplined way, we met all our physicians face to face, primary care physicians, and then we got the answers to all these 3 questions.
How many physicians do you think, if you had to ballpark it, or how many offices did you have to go to and have to meet?
So we have 250 primary care physicians, and we met in person almost 200 of them. So, in between, maternity leaves and vacations, we really met the most of them. And I would like to emphasize to your listeners, because you just said, administrators do not know how to help. You do not know how to help if you don't hear what the problem is from the physicians. And in order to hear what the problem is, it's not enough to fill surveys. We're very good at surveys, and surveys are important. I'm not saying they're not. But one very important act of respect is go to the physicians where they are. And we also toured clinics in that area to see, the actual physical environment that they are in. And also get to know them a little bit on a personal level. They got to know me, and they got to know our executive team, and they got to ask us questions directly. So that's a very important act of respect that I would kind of give as a tip to your listeners. It's a lot of effort. It's a lot of work. It's a lot of organization that has to be done. But if you do that, that's already you're ahead of the pack.
When you're going to these offices and you're speaking with individuals, I'm sure that, some of them were probably very happy. I'm sure that some of them were probably not very happy with different things. Is there any way that you prepared yourself and your team? I know that, you're a physician with lots of leadership experience already, but is there anything that you did to prepare yourself? I know I'm early in my career, and I feel like I'd be very nervous engaging in this kind of work, right? I'd be worried about some of the negative things that are going to be said or some of the tensions that might arise. Any tips for that?
Yeah, so I say, first of all, it's not your age that makes you nervous. It makes you nervous because you are a human being. And as human beings, we do not like bad news and we do not like criticism. And it really kind of hurt us that, somebody's going to say something bad. And you're not alone. I mean, our administrative team at the beginning, when I kind of said to our chief operating officer, we're going to go and we're going to hear all these things. And we're going to go to them and all of us are going to be there. He was nervous as well. He's, oh, we've never done that before. It's a little bit uncomfortable. But this was really an empowering experience for all of us and for our physicians. I went there, as I go in every place. I am always a forever student. So I went there to really learn. And as we structured the questions, the first question was, what's good here? Right? After who are you? The first thing that they had to say is what's good. We didn't start from the bad. It was heartwarming and enormously rewarding to hear our own physicians, employed physicians, stand up and say, I've worked all over the United States and this is the best system I've ever worked in. Many people said, and this is open questions, right? You don't give a multiple choice answers. Many people said, I am so proud to be part of Houston Methodist system. I know we provide the highest quality of care to our patients, and I am so proud to be part of a system that quality of care is our top priority. Many people said, I am very happy to work here because I appreciate the relationship that I have with my team, with my fellow physicians, with my team members that are not physicians. So as an executive sitting there, and these are sometimes, room with more than 100 people, and sometimes they are intimate room with 20 people, depending upon where we went to. You're sitting there, it's everybody that has a heart, the heart a little bit expands, and you already feel joy just by that. Now, the second question was, what doesn't, what are the pebbles in their shoes? And people, after you went through that, kind of introduction, and after you talked about everything that is good, we also talked about, what are the pebbles on the shoes? And, I have here the data. There are 3 things that we heard in 100% of the rooms that we went to. And these 3 things are that it's very difficult for our primary care physicians to refer to social workers and social services. And we needed to hear that because we needed to build an infrastructure within the physician organization to make it better for our providers to refer to social services. So this is it's a valid criticism. It causes, loss of joy, and it really, people care. Physicians, you don't go to become a physician, especially a primary care physician, if you don't care about your patients deeply. If you're unable to help their social aspects of their lives, you feel that you're not doing your job as you could be. So we did that. The second thing that we heard is that it's the most important thing for our providers, the most important thing is to start on time and end on time. And if people are late and the clinic starts late, if patients don't show up, or if the clinic lingers, way after it's supposed to end, this is really a big thief of joy. So we knew that this efficiency of practice should be a high priority for us. And then the other thing that we heard is the administrative burden that our physicians have. And I'm not telling you something that you don't know. As physicians, as the profession of physician evolved over the years, if we were here, you and I speaking, maybe 200 years ago, first of all, you were not speaking to me because there were no physicians women, but let's say there were, the area of medicine was very, very narrow, and people used to take their black bag and take care of anybody in their homes. And the availability and the knowledge was kind of limited, things that you could do. Now the medical information is vast. The accessibility to information, Dr. Google, right, and other, now there's ChatGPT and others. You can ask questions, and you can also reach the doctors in so many ways now. You can write a MyChart message, you can write an email, you can call, you can text. There's endless ways that our physicians can be approached by their patients. And that creates a psychological burden on the physician, because you can't be all the time on. Physicians, I keep saying, physicians are human beings. And we also need a way to manage the load that is, bestowed upon us. So how do we do that? So these are the things that we heard, and we took it very seriously, and we devised a strategy, very meticulous strategy to address all the things that we heard.
How long did that take after you went out and you did this year tour and you got all this data, and of course now personally as well, your whole staff is really invested because they've done it in person and they've really seen this. But how long does it take to devise that strategy afterwards?
Right. So one thing that, I truly believe in as a scientist, that there is no quick solutions, unless you really understand the problem, and then you have to prioritize what you're going to do. There's endless things that we can invest in and do. But we really went about this very seriously. And the way that you said how much time, first of all, the tour itself took a couple of months. So 2 months before we completed and heard everybody. We heard them in person. The second thing that we did, we used the Press Ganey crowdsourcing platform, where people that were not in the sessions, or even people that were in the sessions, could give their ideas of what is the most pressing issues that they are facing. And also in this platform, you can also vote these ideas up or down. So if I'm giving you a solution, let's say I say, referral to social services is really the top priority. And then, another 180 physicians voted and say this is a top priority. When I look at the data, I'm saying, okay, well, this is important not only for one person, it's important for many other people as well. So we did in person, we did crowdsourcing, and then we did 2 surveys. One is the PWAC survey, which we rebranded and named the Jimmy, the Joy in Medicine Initiative survey. It's a wellness and professional fulfillment survey that we distributed, and we got the answers. And then we also did the class survey. The class survey is how satisfied you are with the use of electronic healthcare records and the support that you're getting as a provider for that. So 2 surveys, 1 crowdsourcing, all this effort, and then we took all the data and we sat the entire executive team in several meetings, and we sorted it out according to the framework, what goes into the culture of wellness, what goes into the efficiency of practice, what goes into personal resilience. And then we prioritized and said, okay, these are the things, but we really insisted on doing something, a strategy for every one of these 3 parts. So we have 3 strategies for the culture of wellness, 4 strategies for efficiency of practice, and 2 strategies to enhance personal resilience. And then we once very important thing, you can learn, you can devise a strategy, but then if the people do not know what you're doing, it's completely worthless. So we had our first Jimmy Symposium, Joy in Medicine Symposium, in November, the end of the year, when we finished devising the strategy, and we revealed the strategy. And there were more than half of these attendants of the symposium were providers, both primary care and non-primary care. And they heard me reveal the strategies and what we're doing and how we did that. And we also had a recorded session, a live session that was then recorded with all our primary care providers, basically saying, we heard you.
Mm.
You told us what's important for you, and we devised the strategy and the priorities to address the things that are most important to you. So it shows enormous respect to our physicians and providers, which I strongly feel that without physicians, without people who deliver the care, what are we doing here? We are
Yeah.
all patients really seek to have capable providers, and we as a healthcare system need to make sure that our providers are happy. So there's a respect to our providers, but there's also real action. This is not a nice, feel nice, or even though it feels really nice, I can tell you, I'm really, it fills me with joy and my team with joy for sure. But it's more than that. It's actions that we are taking to make the lives of our physicians and our non-physician providers better. And we're doing it very seriously, and we're throwing, resources and many thoughts about this. And in fact, this has, this tour has concluded in primary care, but this year we're starting a same tour, same kind of guidelines and principles in the specialty care group. And because our specialty group is so much larger than our primary care group, it's going to take us 2 years to complete.
Wow.
And the issues that we're going to hear from our specialty physicians are going to be way different than our primary care physicians. And our strategies to address their wellness and their professional fulfillment, some of them are going to be the same, and some of them are going to be very different.
That is so incredible, the work that, and I love how you're separating it too by the primary care, by the specialty. I mean, that's so important. One last question. Have you seen any early results to share? And if so, when do you expect a more full picture to develop?
Yeah, so I'm going to give you one example that really makes me proud. We have something here at the Houston Methodist system that is called Pathway to Unparalleled. This is an annual kind of a event where all employees were mandated to attend. And what it is a few videos focused on one of our foundational principles. So it can be safety, quality, service, innovation, or other things about our eye care values. And Houston Methodist System has been doing it year after year with very good feedback from our employees. But our physicians were never asked to join. And so before the Jimmy tour, we had only 2% of our physicians join these sessions. When I came, I said, you know what? Our physicians are part of our employees. They're employed physicians. Why are they missing out? Why are we not asking them to attend? So we asked them to attend. And remember, the Jimmy tour was only in primary care physicians. Primary care, we asked all physicians to attend, right? Our total number, last year it was 2%. After we asked them to attend, it was 70%. But 100% of our primary care physicians, 100% attended. So that shows you that, if you go as an administrator, as an executive leader, you go, you take the time, you really give attention to physicians and give weight to what they have to say. Then when you ask them to participate in something, they respond and they're all in. So this is one example of the earlier results that we're seeing. And then, just by my own sense, I have gotten to know so many wonderful people in our organization, physicians and non-physicians alike. And I feel that something special is happening here in terms of what it means to be employed by the Houston Methodist Physician Organization. I can feel it. We're going to measure it as well, but I can tell you, I can already feel the excitement, the pride, this sense of, we can say what's bothering us, and actually there's going to be action to address that.
I imagine a lot of other things are a lot of other initiatives that maybe you're not even involved with are probably going to be going easier because that engagement, that involvement, that morale. I mean, 100% attending, an event like that's unusual for even, I'm assuming, baseline employees at a lot of organizations, right? It's hard to really get, people involved even when things are mandatory. And so I think that's incredible as well to hear about that. I hope we can have you back on, Dr. Schall, in a year or two and discuss where things have gone. I mean, I'm interested in specialty care. I was a medical assistant in neurology for a while. And so I know that brings very different challenges than primary care. And I'm wondering, too, in a couple of years, when you've gone through specialty and primary care, what synergies are going to develop in the organization? So this has been a great conversation, and I hope we can have you back on in the future.
Thank you. Thank you. You're so kind. And I really enjoyed sharing with you something about our organization. Thank you so much for this opportunity.